In the United States, a range of medications is employed in the treatment of autism spectrum disorder or ASD. These top 10 medications play a pivotal role in addressing various challenges presented by this complex neurological condition. Number 10. Risperidone stands as an atypical antipsychotic medication utilized primarily to manage irritability in children and adolescents with autism. The research units on pediatric psychopharmacology or RUPP Autism Network conducted a pivotal study in 2002, which highlighted its effectiveness in reducing irritability in children with autism. A typical starting dose for adults is 0.5 milligrams once daily, administered orally with or without food under healthcare provider guidance. Risperidone is typically taken once a day and may lead to side effects such as weight gain, drowsiness, and an increased risk of metabolic issues like diabetes. 9. Aripiprazole. Another atypical antipsychotic medication is prescribed to mitigate symptoms such as aggression, mood swings, and irritability in individuals with autism. Notably, a study conducted in 2014 validated its effectiveness in reducing irritability in children and adolescents with autism. Adult dosage usually starts at 2 milligrams per day, to be adjusted as needed by a healthcare provider. Administered orally, with or without food, aripiprazole is typically taken once a day and may result in common side effects like weight gain, restlessness, and drowsiness. 8. Methylphenidate, a stimulant medication known for its role in addressing attention deficit hyperactivity disorder or ADHD, is also harnessed to manage hyperactivity and attention challenges in individuals with autism. A study from 2016 showcased its effectiveness in reducing hyperactivity and improving attention in individuals with autism and ADHD. Adults typically commence with a dosage of 5 milligrams once or twice a day, with adjustments made under healthcare provider guidance. Methylphenidate is orally administered with or without food and may lead to common side effects like increased heart rate, decreased appetite, and potential sleep disturbances. 7. Guanfacine, an alpha-2 adrenergic agonist, serves to tackle impulsivity, hyperactivity, and aggression in individuals with autism. A notable study from 2015 substantiated its efficacy in reducing impulsive and hyperactive behaviors in children with autism. The adult starting dose typically stands at 1 milligram once daily, to be adjusted as necessary by a healthcare provider. Guanfacine is taken orally with or without food and is generally a once-a-day regimen. Side effects may encompass sedation, low blood pressure, and drowsiness. 6. Sertraline, a selective serotonin reuptake inhibitor or SSRI, well known for its role in addressing depression and anxiety, is also deployed in the context of autism to manage anxiety and obsessive-compulsive behaviors. A clinical study from 2017 affirmed its effectiveness in reducing anxiety and obsessive-compulsive behaviors in children with autism. Adults usually commence with a dosage of 50 milligrams per day, with adjustments under the guidance of a healthcare provider. Administered orally with or without food, sertraline is generally taken once a day and may lead to side effects like nausea, diarrhea, and potential sexual side effects. 5. Oxytocin represents a naturally occurring hormone that is sometimes administered as a medication to enhance social and communication skills in individuals with autism. A clinical study published in the Journal of Molecular Autism in 2015 demonstrated that oxytocin can lead to improvements in social interaction and communication in adults with autism. The dosage of oxytocin may vary, and it is typically administered through nasal spray, with specific doses determined by a healthcare provider. The method and frequency of administration are guided by healthcare providers, and potential side effects may include nasal irritation and, less commonly, headaches. Should you have any inquiries regarding your medication, we've crafted a dedicated book for your benefit. 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to explore it. 4. Melatonin, a hormone naturally produced in the body, is sometimes employed as an over-the-counter supplement to improve sleep patterns in individuals with autism who experience sleep difficulties. A study published in the Journal of Autism and Developmental Disorders in 2018 suggested that melatonin supplementation can improve sleep quality in children with autism. The typical starting dose may range from 3 to 5 milligrams, taken about 30 minutes before bedtime. Melatonin is available in various forms including tablets, capsules, and liquid, and should be taken according to the recommended dosage and instructions. It is typically taken once a day about 30 minutes before bedtime, with common side effects being minimal, often limited to mild drowsiness the next day. 3. Naltrexone. Primarily an opioid antagonist used in addiction treatment, can also be prescribed to reduce self-injurious behaviors and aggression in individuals with autism. While a specific clinical study on naltrexone for autism is limited, the dosage often begins at 25 milligrams per day, under the guidance of a healthcare provider. Administered orally, the dosage should be strictly in accordance with healthcare provider recommendations. The dosing interval may vary based on individual needs, and common side effects may include nausea, headache, and dizziness. Consulting with a healthcare provider is essential to monitor and address any potential side effects. 2. Secretin. A hormone involved in digestion has been explored off-label to enhance social interaction and communication skills in individuals with autism. It's important to note that research on secretin for autism has yielded mixed results, with some studies reporting potential benefits and others showing limited improvements. If prescribed, the dosage and administration method will be determined by a healthcare provider, as well as the dosing interval. Potential side effects with secretin are viable, and consultation with a healthcare provider is essential for monitoring any adverse reactions. 1. Trazodone. Commonly known as an antidepressant, serves a dual purpose in addressing both sleep difficulties and aggression in individuals with autism. The starting dose usually varies from 25 to 50 milligrams, with healthcare providers making necessary adjustments. Administered orally, typically before bedtime, trazodone is taken once a day, commonly resulting in side effects like drowsiness, dizziness, and potential digestive issues. Although specific research on its use in autism is limited, studies on its efficacy in managing sleep difficulties show promise. In the realm of autism treatment, medications serve as valuable tools to manage challenging symptoms and improve the quality of life for individuals with ASD. The decision to use medication should always be made in consultation with healthcare professionals who can assess an individual's unique needs and potential benefits and risk associated with each medication. It's important to note that while these medications have shown promise in managing certain symptoms of autism, they may not be suitable for every individual. Moreover, treatment plans often combine medication with various forms of therapy and behavioral interventions to achieve the best outcomes. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is committed to delivering valuable health and wellness insights crafted by a certified expert. In these challenging times, staying well-informed about self-care is of utmost importance. If you find our content helpful, please support us by giving this video a thumbs up. Your feedback lets us know how we're doing. If you'd like to see more of such content, consider subscribing and activating the notification bell to stay updated on our future videos. Thank you for tuning in.